Hospice must find £400,000 to cover rise in NI costs. The Prime Minister has said he recognises pressure on hospices, as one facility in Wiltshire revealed it must find an extra £400,000 to cover its national insurance contributions. From April, employers will have to pay NI at 15% on salaries above £5,000, instead of 13.8% on salaries above £9,100 currently. Dorothy House Hospice Care looks after people across Somerset and Wiltshire at the end of their lives. It says it will need to scale back its work if the government does not provide more funding. Prime Minister Sir Keir Starmer said the government has invested £100 million into hospices and £26 million more into those which care for children and young people. This funding was announced in December and is intended for spending on infrastructure. Speaking at Prime Minister's questions earlier, from an East Somerset MP Ines Sabine asked Sir Keir to meet with representatives from the sector. He agreed to arrange a meeting between her and Wes Streeting, the Health and Social Care Secretary. Ms Sabine told MPs about the struggles Dorothy House, which has its main base in Winsley, near Bradford-on-Avon, is facing. It costs £19 million a year to run the hospice, with 80% of its money coming from fundraising. Its financial director Tony Diego told the BBC, "Hospices throughout the UK are facing financial crises with the cost of living increases." He said the hospice is now facing very difficult decisions about how to prioritise desperately needed care. The hospice is turning 50 next year and is facing a financial shortfall. Mr Diego warned, without more support, the quality and quantity of care will be impacted. Hospices play a really valuable role in provision of care which the NHS is not able to do as much of as it would like. Sustainable funding would provide people with the dignity and quality of care they deserve, Mr Diego added.